I'm Brinston Phipps, MD, orthopedic surgeon, affiliated with Animas Orthopedic Associates, and we are operating through Animas Surgical Hospital. Well, there are different types of arthritis. There's the juvenile rheumatoid arthritis that can affect teenagers, and up to the most common, which is osteoarthritis, which is typically age-related, usually affecting people in their fourth decade and beyond. There's about 20 million U.S. Citizens dealing with arthritis year to year. But predominantly arthritis affects an older population. Arthritis can affect any joint. It can be in the hands, it can be elbow, shoulder, knee, wrist, ankle. I personally deal mostly with hip and knee arthritis. Pain is the most common feature. It's usually a dull ache associated with the joint in question. There's often stiffness that associates with it. People will wake up and have stiffness that seems to free up after about a half hour. That's commonly reported. And you just get more and more debilitated, that you have more aches that are keeping you from doing what you want to do. Some of the supplements that are available to help delay the progression of arthritis out there include the glucosamine, chondroitin sulfate, MSM, which is basically organic sulfur. Fish oil has been looked at, the omegas. The data on it's just not real compelling. I find that it's not detrimental. One area that patients and physicians alike have grown interest in is called platelet-rich plasma, which is where we receive the blood from the patient, spin it down to the platelets, and try to get the growth factors from those platelets to deliver a healing response to the diseased cartilage. But once the patient does get to the point where these measures have not gotten them back to the quality of life that they desire, then we start talking about surgical endeavors. And the role of arthroscopy, where we put a camera in the hip joint or the knee joint, try to clean up the damage or destructive process, we're moving forward more towards trying to continue mainstay with conservative treatment options, but there are situations where potential benefit can be conferred with something as simple as an arthroscopic surgery. However, more frequently we look at having to replace the damaged joint, which would be either a knee replacement or a hip replacement in my practice. And with respects to knee replacements, there's over 1 million done in this country each year. It's a very common practice. Most patients do fantastic with them. Common statements are, I should have done it sooner. Why did I wait so long? But it is worthwhile to try to put off surgery if you're still functional and have a good quality of life. Being active and fit and healthy going into surgery makes it easier on the patient for sure. We can get people back to active lifestyles. Unfortunately, running is an impact activity that is a little bit more jarring on the implant. We kind of frown against running, although we'll let people golf, hike. I let people play tennis, try to encourage them to consider doubles over singles so there's not as much court coverage. Cycling unlimited, swimming, hiking. So most of the activities that they were able to enjoy. I've seen some patients recover really fast. We're watching a gentleman right now who's after 3 months after his knee replacement, says he's skiing better than he's skied in 10 years. And he's an aggressive skier. I've seen him on a mountain, he's skiing better than I am. And so people can get back to real active lifestyles. It's fun to watch. That's the enjoying part of the job.